every year, I should say, in addition to having a broad call, we also try to make a call for one of the Alumni Hall of Fame now to be a rapidly rising new star, a young alum, as well as our incredibly accomplished alums who have been at it for a long time. So our first Hall of Fame inductee is Rachel Hornstein. Rachel only recently earned her Master's of Public Health from the school in June of 2013. But as Neil Segal, SPH alum, and one of the 4 people who all independent of one another nominated Rachel for this honor. So they decided to reply. They spent all this time and they all picked her. He shared her early career exemplifies her commitment to the ethics of service and leadership, which I hope all alumni of our school aspire to. In the 4 short years since Rachel graduated from the Fielding School, she's made incredible headway in her career. She currently works for the Centers for Disease Control and Prevention. She's a health policy analyst in the Office of Planning, Budget, and Legislation. She's on the front line of the data collection there that's so essential to the work of doing public health across the country through the CDC. Prior to this, she worked for the U.S. Department of Health and Human Services in the Office of the Secretary, the Assistant Secretary for Planning and Evaluation. There, too, where she identified, reviewed, and tracked the implications of public health efforts. She's also worked in the Office of the U.S. Surgeon General as a public health analyst, where she developed strategic plans to reduce tobacco consumption and prescription drug abuse and inform policies related to nutrition, physical activity, mental health, and violence prevention. During her time as a student, she had already begun. She worked during that time as a health policy advisor for then President Obama's re-election campaign. She worked at Cedars-Sinai Medical Center, where she conducted comprehensive review of the cost and benefit of their palliative care. And she served as a consultant for Merck Pharmaceuticals. It's pretty clear to me that she did not follow my earlier advice that Dr. Breslow said sleep matters. So, as Dr. Nunez Ponce, professor of health policy and management, shared in her nominating letter, what distinguishes Rachel is her strategic mind and passion in ensuring the best possible data to inform health policy. In 2015, the Department of Health and Human Services Idea Lab selected and awarded Rachel its Ignite Accelerator Award. Rachel, we are honored to have you as an alum, excited about the tremendous impact you've already had, and can't wait to see the future impact. Please join me in congratulating her. Congratulations.
Good evening, everyone. How are we doing? Good.
Great.
My name is Rachel Hornstein, and I am so honored to receive this year's Young Alumni Hall of Fame Award. Before I begin, I would like to say a special thank you to the UCLA Fielding School of Public Health, the Alumni Association. I'd like to say a special thank you to Dean Hyman for this incredible honor. And then it's a special treat to have Dr. Fielding here. He was also one of my professors when I was here, and it's lovely to see you. And I'm also happy just to be back here at UCLA. This place has fostered and supported so many bright young professionals in the field of public health. And I know for me, I couldn't imagine working in any other field but public health. We as public health professionals are united in wanting to take action early to reduce threats to health before problems even emerge. We do this by using the best surveillance data and tools that we have to understand what's happening in the public health to help us inform which actions to take going forward. In my current work at the National Center for Health Statistics within the CDC, we serve as the nation's principal health statistics agency, which leads the way with accurate, relevant, and timely health data. We use our statistical information to guide actions and policies to improve the health of the US population. By working for NCHS, I've noticed that we have some really serious problems in healthcare. The social costs are immense, and we've seen them looking at health disparities in the current prescription drug opioid crisis. We've also seen this in the rising rates of obesity for adults and for children. However, there are many improvements that we see in public health, which are due in large part to the federal, state, and local government's role in collaborating and coordinating across multiple sectors. We have seen a decline in the current use of cigarette smoking, uninsurance rates have been decreasing, and deaths from cancer, heart disease, and stroke have also been on the decline. And I know for me, I came to Washington almost 4 years ago with the dream of serving in the remarkable administration and to make real and lasting differences for the American people. I went into public service to make real change happen, to improve the lives of our families, our friends, and our neighbors, and to make a more equitable future for our children. And I had the honor to work in the Office of the Secretary at the Department of Health and Human Services to see health policy and public health programs take action and change lives in real time. I know, and we all know, that public service has never faced as stern a test as it does today. People are watching our government, and with this challenge comes an opportunity. And despite the many challenges that public health faces, I remain positive. I remain positive because I've seen improvements in public health leadership and different uses of technology to improve lives. I am also confident that in the long term, the public and policymakers will allow public health practitioners at the local, state, and the federal health departments to build upon their distinguished history of service and to continue to add more years to our lifespan and to our health span. So on behalf of this award, I would like to thank my family and my friends, but more specifically, I would like to thank my older brother, Josh, and my sister-in-law, Jessica, who are both here in the audience tonight. I would also like to thank my current supervisor, Susan Queen, my dear friend and mentor, Kristen Link-Young, my UCLA advisor and friend, Dr. Dylan Roby, and I'd also like to thank my love, Mark. So thank you so much, and I feel really honored to be here.